in the long term, it's really advocating with Congress, et cetera, to really make the point of how important it is for uninsured adults first to have insurance, but then also, of course, for uninsured adults to have access to vaccines.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Mariah Bernzaloff, and I am hosting today's podcast. I'm the program manager of the Adult Vaccine Initiative at Bronx Health REACH, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. In response to recent changes in the vaccination schedule policies and the list of approved vaccines, Bronx Health REACH brought together a group of distinguished experts for a panel discussion on July 30th to address concerns many community members had about access to affordable vaccines, vaccine ingredients, common myths, and other related issues. One of the panelists, Dr. Bindy Crouch, is the Assistant Commissioner of the Bureau of Immunization at the New York City Department of Health and Mental Hygiene. Dr. Crouch's work has focused on promoting evidence-based strategies to increase vaccination coverage across New York City. She has participated in several vaccination campaigns in response to public health emergencies, including the H1N1, COVID-19, Mpox, and asylum seeker campaigns. At our July 30th panel discussion, I asked her to discuss routine vaccine coverage among Bronx residents, where the gaps are, and where there are opportunities in improving the rates of adult and child routine vaccine uptake. Thank you again, Dr. Bindy, for being here today. I know that many Bronx residents think many people have gotten vaccinated or get vaccinated for their routine vaccines, but what is the reality in 2025?
Sure. Thank you so much. And, thank you to Bronx REACH for addressing this topic, and two, of course, for having me here this evening. And I'm really looking forward to a robust discussion. So I'll talk first just about the pediatric coverage in the Bronx. And when I do that, I want to just say that we recently launched a pediatric vaccine coverage data explorer on our website. And anybody can go onto this website, and then there are different ways that you can break down vaccination coverage for children. So you can look at different vaccines, and then you can also look by borough of residence, by zip code, by race, ethnicity. So it's a really great website. That website will be updated on a semi-annual process. Right now we have data up that goes through June 30th, and we're working on some updates on that site. So really encourage all of you to take a look at that website. It's a great place to see pediatric coverage across New York City. So, but in general, in the Bronx, pediatric vaccination coverage is either similar or slightly higher than our citywide averages. So I'll give a couple of examples. First of all, among 2-year-old children in the Bronx, coverage with the recommended doses is high for some of our routine vaccines. And that includes, for instance, polio vaccine, where we have 98% coverage in the Bronx, MMR vaccine, where we have 96% coverage, hepatitis B with 98% coverage, and varicella, 96% coverage. And those numbers are really important because, again, these are children who are only 2 years old. And so they're not required to have vaccines for school yet unless they attend a childcare or a daycare. So, I think it's really fantastic how high those numbers are in the Bronx. There are some gaps and opportunities perhaps for improvement among this age group for some of the other routine vaccines. So that includes for the DTaP vaccine, which includes both tetanus and pertussis for whooping cough. It includes a vaccine called H influenza B, which prevents infections that we really, severe infections that we don't see that often anymore, like meningitis and severe throat infections. And for our pneumococcal vaccines, or the vaccines that prevent pneumonia in children. And then we also look specifically in this age group at this combined 7 vaccine series. So it includes all of those routine pediatric vaccines that I just mentioned. And for the Bronx, coverage of those for children to have all 7 of the vaccines and the appropriate doses is about 72%. And then I just also want to note the one place where we don't do as well as a city on coverage for children is our flu vaccine. And so among children who are 6 months through 17 years living in the Bronx, we have coverage of just 30%, which is a little bit lower than our annual citywide average, which is 34% for that same age group. So that's among those children, again, 6 months to 17 years. I do want to point out that the Bronx is a leader in HPV vaccination, so vaccination against the human papillomavirus. We have our children in the Bronx who have completed that full series by the time they're 13 years old, is 93%, is 62%. But we will compare that to the citywide average, which is 46%. So Bronx is doing much better in that category. And then if we don't look at just our 13-year-olds, but we give them a little bit more time to get vaccinated, and we look at the 13 to 17-year-olds, we have 93% coverage in the Bronx compared with 76% citywide. And that is just phenomenal coverage. It's really exciting to see. And I think what's special about the HPV vaccine in terms of coverage is that this vaccine is not required by schools. So this is your physicians, those of you who are community leaders, working with the residents in the Bronx, ensuring that they get these life-saving vaccines, even when they're not required for school. And the adult vaccination coverage, this is much harder for us to give you data. And this is because of the way that doses administered to adults get reported into the health department. We do not have a requirement for doses to be reported to the health department. And we also require that an individual consents to have their dose sent into our registry. So I don't have adult coverage for you for the routine vaccines. The one vaccine that I can tell you about is flu vaccine coverage in the Bronx. And we look at coverage among adults for flu vaccine in a slightly different way than we do for children. We take this information from a survey that's conducted every year by the health department. It's called the Community Health Survey, and we ask those individuals whether or not they have received a flu vaccine in the previous 12 months. So the most updated data that I have tonight to share comes from our 2023 Community Health Survey, and we can look at both 18 and older, and then we can separately look at individuals who are 65 years and older. So for 18 years and older, citywide coverage is estimated at 50%. In the Bronx, that number is 49.4%. So Bronx is just about at the average for citywide coverage for all persons 18 years old and older. Now, when we look at separately at those individuals who are 65 years and older, and we always like to look at this age group because we know that they are at especially high risk for having complications from influenza. So looking here, our citywide coverage is 68.9%. And our coverage in the Bronx is 72.9%, so higher than the citywide average for those individuals in the Bronx who are 65 years and older.
Thank you so much, Dr. Crouch. This is really fascinating and really helpful information to know about what's happening in the Bronx and how much coverage we have in terms of it sounds like there's some positives and then there's some areas for improvement, as you said, especially around making sure children receive all 7 vaccines in their series. I was not aware of the DTaP, pertussis, the HN influenza B, meningitis, and pneumococcal were areas for improvement. So that's interesting. Um, and the flu, that we still have some challenges in terms of making sure
Yes.
we get enough people vaccinated for flu in the Bronx. Did the recent news about vaccine schedule changes affect your patients' decisions about vaccinating at all?
So the news is still pretty fresh, and most of my patients are underinsured or uninsured, with many whose primary language is not English. So their focus is less on news and politics and more on, taking care of their families. But I think over time, as this news becomes more common knowledge, it's likely to affect patient decisions in the future.
What are the short-term or long-term effects of recent policy changes in the U.S. vaccine schedule and approved vaccine list on New York City community members' access to affordable vaccines?
I think that this is absolutely the right question to be asking right now. And, we know that the effects of any policy changes are really going to be far-reaching and unfortunately could be devastating. We know that already changes are causing confusion. And, as has been mentioned already by the other panel members, already likely eroding vaccine confidence. So I do want to say that, the health department, in collaboration also with New York State Department of Health, where we will be working to ensure that there is very clear guidance for providers, for community leaders, and for the general public. And in particular, this summer, we are watching some of our national partners, and we're expecting some of our national partners, like the AAP, like the AAFP, to provide, be reviewing data and providing evidence-based guidance for administration of our fall vaccines, so flu, COVID, and RSV vaccine. I think it's very fortunate that in both the medical and the public health communities, as we can see just by the panel here. And I think that includes our state partners, our national partners, are working with health insurance plans specifically to cover safe and effective vaccines and vaccination services. And so, I think that there's been a statement by the Association of Health Insurance Plans about their intentions to continue covering these vaccines. We have yet to see what's coming for the fall, but there is a lot of advocacy, and there are insurance plans out there that want to cover vaccines that are safe and effective and will. But and I just want to clearly state that over the summer, you can expect some of our associations to be providing vaccine recommendations, and both the city and the state health departments will be providing clear guidance to our providers, and we will be posting on social media so that our communities, our community leaders, the general public will be able to see what the recommendations are.
With the recent outcomes from the June meeting, not recent, but during the June meeting for the Center for Disease Control and Prevention's ACIP Advisory Committee on Immunization Practices, the group that provides advice and guidance on effective control of vaccine preventable diseases in the U.S. Is there any concern about a delay in the rollout of routine adult vaccines in the fall of 2025? I'm thinking of possibly COVID. It sounds like flu won't be delayed, but does anybody know if that might happen?
So we're not expecting any delays. So for the flu vaccine, the change that they made at the June meeting for the flu vaccine, of course, is to recommend only thimerosal-free vaccines for all age groups. But just to note that the only vaccines right now that include thimerosal are flu vaccines that come in multi-dose vials. And in the United States, it's just about 4 to 5% of all flu vaccines that are in multi-dose vials. So the overwhelming majority of doses in the US already are single dose preparations. We've looked at our data here in New York City, and based on our data in our registry, which again, for adults, it's not complete, but we have really robust data for our children. We're also at about 4% of doses administered that are from those multi-dose vials. So we are not expecting there to be any shortages or delays in flu vaccine this fall, though we are watching closely and staying in touch with our partners, including the manufacturers. On the COVID vaccine side, I don't. We're hearing from the manufacturers that they will be ready to go this fall with updated vaccines. So we're meant to see a 2025-2026 version of the COVID vaccine. The manufacturers are working on these vaccines already. They also are expecting that they will have plenty of supply for the start of the season. So we're not expecting delays there either. And then for the RSV vaccines, for the older adults, RSV vaccines are available year-round, and we have not seen any shortages thus far for those RSV vaccines. For pregnant persons, we're also the vaccine that we use in pregnant persons is one of the same vaccines that we use in older adults, and we haven't seen any shortages there. And then for our babies, we also have some products called monoclonal antibodies, and we are expecting good supply. And in fact, ACIP has now recommended a second product that will be available. So we're not expecting delays there. So as of right now, despite some of the, chaos that is being generated out there about vaccines, we're not expecting delays and we're not expecting shortages. We certainly will be keeping close eye on that, though.
What can communities do to increase these vaccination rates among adults and children during all of this? I mean, what suggestions would you have?
There are some programs that the health department was involved in, including like we had since COVID, during and since COVID, we've had this program that we called the Continued Access to Vaccinations for Uninsured Persons. And so unfortunately, that program has ended at the end of June. And unfortunately, we do not have funds for us to provide additional financial support to the health centers. So I do think that we're going to have to be, working together in the community to really figure out, where can FQHCs, where can some of our independent pharmacies, how can they help get the community vaccinated? I hate to be the bearer of bad news, but I think you all are, many people are aware about funding issues in public health and healthcare. And so we will not have that program this year, but we do have we have a couple of designated locations for adults who are uninsured to get vaccinated. But certainly we do not have the access that we wish we could have. I think that we're in a better position again for the children, of course, because of the Vaccines for Children program that specifically covers vaccinations for uninsured children. But for adults, this is just such a challenge for us. And I think, in the long term, it's really advocating with Congress, et cetera, to really make the point of how important it is for uninsured adults first to have insurance, but then also, of course, for uninsured adults to have access to vaccines.
To find out where you can get vaccines in New York City, visit the NYC Health Map. If you would like more information about vaccines, visit our webpage at institute.org/vaccines saves lives.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.